Hi, my name's Brooke Winecki, and this is my Module 5 presentation about my pathological condition, which is anxiety disorder. So, what is an anxiety disorder? This is when one experiences a constant, consistent anxious feeling that is brought upon by problems. It can be brought upon by taking tests, that test anxiety that people have, or making life decisions. There's a difference between an anxiety disorder and just an anxious feeling. Sometimes people do have this anxious feeling, but an anxiety disorder takes that anxious feeling to a whole new level, which I'll kind of go into throughout this presentation. So there's several categories under an anxiety disorder. There's a social anxiety, which is kind of where people become scared, nervous, hard to maintain relationships, difficult going to parties, talking to people. It's just very difficult to socialize. Generalized disorder, this constant feeling of being anxious, which I'll kind of talk about, and emotional effects, how someone reacts daily with an anxiety disorder. There's panic disorder, which can cause a lot of medical and physical problems to the body that I'll also discuss later. And then phobias. Phobias are those fears, fear of bikes, fear of cockroaches, fear of rats, fear of weird things that we might think are totally ballistic and not make sense, but they make sense to the person who has the phobia. So, an anxiety disorder can result from different neurological factors. They can be from biological factors like genetics, psychological factors, social factors, unemployment, poverty, lack of support, or just certain behaviors that are going on. Anxiety is usually an associate with other medical conditions, but typically genetics, environment, and trauma are those three that are typically the influences to an anxiety disorder. Some just deal with stress differently, and some are more vulnerable to stress, which is a gateway to an anxiety disorder. Yates was someone I did a lot of research on when I was going through and doing my papers, and one of his quotes really stuck out to me and has a good setup for an anxiety disorder and a good starting point to explain anxiety disorder. So, an anxiety disorder, he explains, is that the cognitive theory has explained anxiety disorder as a tendency to overestimate the potential of danger. Patients with anxiety disorder tend to imagine the worst possible scenario. So, just keep that in mind as we're kind of going through the rest of this presentation. So when we're talking about some of the emotional effects, we have that constant fear or worrying. This would be more for a generalized anxiety disorder. Feelings of apprehension, trouble concentrating, feeling tense and jumpy, anticipating the worst, irritability, restlessness, constant alertness, and watching for signs of danger. Also feelings like the mind has gone blank. It's kind of, again, that trouble concentrating. Hard to really focus on one thing at a time and remember those thoughts. Sometimes things can just be lost. You really remember it. You think you studied for that test really, really well, get the test, and your mind just goes blank. It's actually something really difficult for people to go through. Physical effects, so we have pounding heart, sweating, stomach upset, dizziness, frank or urination, kind of something that happens even to the everyday person when they're going through a little bit of a stressful event. Just that feeling of having to go to the bathroom all the time. Shortness of breath, switches, muscle tension, headaches, fatigue, and insomnia. Insomnia is a big one that I'm going to talk about when we get to medical problems and consequences of anxiety disorder. So the cells and organs affected from an anxiety disorder, we have the brain. There's two parts of the brains that are really affected. We have the amygdala right here and the hippocampus right next to it that are actually the two big parts of the brain that are really affected. So since anxiety disorder is a pathological condition, it's no surprise that one of the most affected organs is the brain. When one experiences an anxiety attack, the amygdala triggers an emotional response to a stressful event. It may not be that big of a deal, but someone with an anxiety disorder kind of overestimates everything and overdoes it, which again is not their fault, just the way the brain reacts to things. So this triggers a hormone, sends out neurotransmitters, and releases a neuropeptide S, which is a small protein that decreases sleep and increases alertness. Kind of that insomnia is what we're getting into. The hippocampus stores any emotional experience, so any anxiety attack or emotional events that have happened, the hippocampus stores, and the brain relates back to those and thinks about those. So the person's constantly thinking about past events, and that affects also their anxiety disorder. When an anxiety attack happens, the brain becomes essentially confused, and instead of switching nerve cells off, it turns them on. So it's as if the brakes are failing in response to stress. The brain is a control center of the body, as we know, and due to all of that that is going on and miscommunication in the brain, the body as well is going to go into the stress reaction. The heart works extra hard to supply blood to the rest of the body as everything's moving really fast and things are upbeat. We're trying to work extra hard in our body to keep up with the brain and everything it's thinking and going on and sending out all those neurotransmitters. The body's trying to keep up with that. Blood pressure and respiration increase, dryness in the mouth occurs, and finally the skin breaks out in a sweat. We know that when we get nervous, our skin starts to break out in a sweat. So that's another thing that happens. From those organs, the brain, heart, lungs, and all of that, we have our organ systems that are affected. We have the nervous system, the cardiovascular system, the circulation or blood, and the respiratory system. So a good comparison to an anxiety attack is a fight or flight response. That's what the body essentially is going through. The body works 10 times as hard as it normally does during an anxiety attack. However, the nervous system is always working a little bit harder for someone who has an anxiety disorder than everyone else. With an anxiety disorder, someone's on edge most of the time, so that's constant worry and stressful thought that can become a burden on the body and cause physical medical conditions to the body if it's not kept under control. The nervous system signals the rest of the body. The heart races as feelings of worry and concern arise. Once again, breathing becomes heavy and rapid. The blood has to run faster to help support the rest of the body working super hard. Our short-term consequences, kind of the same thing as we were talking about with our physical effects. Difficulty swallowing, dizziness, dry mouth, rapid heartbeat, rapid breathing, headaches, inability to concentrate, muscle aches and tension, troubling and twitching, and off mindset for the rest of the day. Someone who kind of goes through these anxiety attacks has a different mindset than everyone else. Their brain obviously is working extra hard. But for the rest of the day, they're kind of not all the way there. They're thinking about other things. It's very hard to get their brain back on track after going through this hard, stressful experience of this anxiety attack. Especially, it could even be taking a test. After taking a test, that person's mind for the rest of the day is out of it. They're done. It's very hard to get back on track with the day, which is why an anxiety disorder can really affect daily activities and daily life. For long-term consequences, we have substantial increase for heart problems, which can be stroke. Once again, the heart's working extra fast, so stroke can play a huge factor into that. We have damage to those hippocampus cells, which play the part in the brain that are one of the two main parts that are affected by the anxiety disorder. Insomnia and depression are those two main consequences I really want to focus on. Depression and anxiety disorder go hand in hand. They're like best friends. In my research, I found that someone who suffers from an anxiety disorder, at least once in their life, they will suffer from depression. Okay, so just think about that for a second. Someone who suffers from anxiety disorder is also going to suffer from depression at least once in their life. At least once. That can be really hard to deal with. Anxiety is not by itself. There are things that go with it. And insomnia is also another one. That person's up constantly worrying about things that are happening. So sleep is going to be really hard for them. Also, that detrimental impact of emotional distraction. They get very distracted very easily. So prevention and treatment. Anxiety can be helped. Cannot be solved necessarily, but it can be helped. It can be reduced. So there are different treatments. Some treatments work better than others and some take longer to work. When it comes to therapy, there are two different types within an anxiety disorder. There is cognitive behavior therapy, which focuses more on the thoughts and behaviors by helping to identify one's challenges, influence, beliefs, and patterns. The other is exposure therapy, which is essentially where the patient is taking the bull by the horn. This form of therapy has the patient confront the fear in a safe environment and help to gain self-control. A medical treatment is used in addition to another form of treatment. A medical treatment is used when the anxiety disorder is affecting the daily lives and activity, but once again is used with another form of treatment. Complementary and alternative treatment is used outside of conventional medicine. Complementary treatment is, for instance, following a diet to help going through some kind of body issues instead of going through a procedure. Alternative treatments are like at-home remedies. They can be yoga, aromatherapy, or even acupuncture. It's all about getting the body nice and calm. The last treatment is transcranial magnetic stimulation. This is where a magnet is used to activate the brain in a special mood regulation and stimulates the nerve cells and reduces the side effects of an anxiety disorder. It's all about keeping that brain nice and calm, and this transcranial magnetic stimulation is used a lot for anxiety disorders and depression. There are preventions. It's all about keeping the brain relaxed, so trying to train the brain to stay calm. Reducing the intake of caffeine and alcohol, getting enough sleep will prevent that insomnia. Exercising regularly can really help reduce the stress on the body. Relaxation techniques like deep breathing and really talking and connecting with people can help people with that anxiety disorder. It's something that can be helped and should be something that is taken seriously as well. People should do their research about their anxiety disorder. So I really hope you enjoyed my presentation about an anxiety disorder.